television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon, and I'm very pleased you could be with us for this next segment. I have the illustrious Barbara Quinn, RDN, and she's going to teach us what the initials are, registered dietitian, right? Nutritionist?
Correct.
Barbara, thank you so very much for being here today.
Thank you for having me.
Thanks for coming on the program. Barbara, nutrition and diet and what we eat is so incredibly important, and it's in the news, it's on the television. We're going to talk about children's obesity and maybe something about diabetes if we have time. But before we get into that, let's teach the audience about you. So, Barbara, tell us about your training and your schooling, and then I want to teach the audience a little bit about what the day is like for a registered dietitian.
Okay. Well, I'm a registered dietitian, and I was just telling you earlier that now that's the registered dietitian nutritionist. RDN is the new title that we're using. I went to school in New Mexico, which is where I'm from, and got my bachelor's in dietetics from New Mexico State University, and then I got my master's degree at Colorado State University in food science and nutrition.
Okay, so Barbara, see, I think that's very important to emphasize. So after high school, you got your, you got your 4-year degree.
Correct.
And then you went on to get a master's degree.
That's correct. Mm-hmm.
So you're a highly trained professional. You don't just give advice to people based on a few articles that you've read, or you just don't talk to them about cooking properly. You have a advanced degree, the RDN.
Right, and we talked about in our profession that there's a lot of, nutritionist is kind of a generic term, but registered dietitian is, that's the kind of training that a registered dietitian has to have.
Perfect. So as you said, you have a master's degree, and you got your master's of science degree in food science. Excellent. Mm-hmm. Okay, so tell us a little bit about your day and what your week is like as a registered dietitian nutritionist.
Well, I love my work, and I've been at the hospital actually for 25 years. Started off doing inpatient, where I was seeing patients in the hospital, but now I totally am over at Ryan Ranch at that facility. That's our nutrition therapy and diabetes program. So I see quite a few people who come in who are referred from their doctors, newly diagnosed diabetes, people who've had it a while, children with obesity issues, allergies, eating disorders, anything that could require some nutrition therapy, any medical condition, we see those patients. And then we also do lots of things like this. We go out in the community, we do health fairs, we do speakers bureau where we talk to different people. And then I also write a column for the Monterey County Herald, so that keeps me busy as well.
Well, Barbara, you're in top demand, and you're a great teacher, and I appreciate you coming on the program. So can we talk a little bit about what we call, or what you call, the Kids Eat Right program?
Kids Eat Right, correct.
I think that, of course, it's all over the media that obesity is epidemic in this country, and even childhood obesity is alarming, the rates of childhood obesity. And of course, if we have time, I want to talk about diabetes, touch on diabetes that we can diagnose even in children. So tell us about the Kids Eat Right program.
Kids Eat Right. Well, I had actually heard about this program when I was at a annual meeting for the Academy of Nutrition and Dietetics back in Boston a few years ago. And it's an initiative for obesity prevention for children. So we took that concept at Community Hospital, and we have a pilot program going on now at some of the elementary schools in the Monterey School District. So we're in our 3rd semester of doing this pilot program. It's an after-school program, and we teach the kids about shopping smart, cooking healthy, and eating right. So they get some fun exercise, they get to taste some new foods, they get to prepare some recipes, and decide if they might want to make some changes in how they eat.
Great. So Barbara, where does the program or the teaching sessions, where do they go on? Is it at the hospital? Is it in the schools? At the YMCA?
This actually goes on in the after-school programs for the Monterey School District in specific schools. We started out at the elementary school in Marina. We're currently over at Highland Elementary in Seaside. We've done some at some of the other elementary schools in the area. So these are kids that are there for the after-school program, and so they're kind of a captive audience. But we're really hoping the hospital is actually pursuing some grant money right now to possibly spread this into some of the other schools, because it tends to be a very helpful program for these kids.
Excellent. Well, Barbara, I have a question for you. Some parents or guardians take the approach that whatever a kid sort of craves or wants to eat, the child's body is telling them that that's the food that they should go out and get. If they have a craving for chocolate or sugary foods, or they have a craving for their favorite burger at a fast food store or place to eat, that their body is just telling them what they're supposed to eat. But I'm not sure that that works out so well for children. What do you think about that approach?
It doesn't really work out so well for children. They've done studies, and a child has to be exposed to a new food at least 10 times before they can decide whether they really like that food or not. So
amazing.
It's 10 times, right. And so again, presenting a healthier food in a variety of different ways, in a non-judgmental way, and not telling the child they have to eat the food, but for instance, in Kids Eat Right, we make a broccoli salad. We have the kids chopping up the broccoli and adding some raisins and making a dressing for it and mixing it up and asking them to taste it. And we thought, this is not going to work. And actually, a lot of the children really do like the new tastes when they have a chance to kind of help prepare it themselves.
Well, Barbara, I have another tough question for you. Let's say that you meet a young person, let's say they're in 8th grade or freshman in high school, and their pediatrician tells that young person and their parents that they would be healthier or better off if they lost 50 pounds. So how do we go about, or how do you go about conveying to that child and family that they might change their diet, and what about exercise, and what about medical follow-up? So what are the steps that you can take to help a young person get into better shape, lose weight?
Boy, that's the crux of the whole thing as far as what families need. Every child is a little bit different. We do encourage the parents to come in and talk to us, and if it's an older child like an adolescent, sometimes we'll see the adolescent by themselves. And as we know, there's so many variety of issues that are around weight loss. But most of these kids, we actually are all health and wellness coaches as well. And so if you're coaching them to find out what motivates that child, we've been pretty successful with having the kids lose the weight. But exercise is a huge part of it.
Excellent. And Barbara, we can perhaps touch base on this before the end of the segment, but if someone is listening, if there's a young adult or a teacher or a parent listening, how can they perhaps get your program into their schools? Is there a way that you can do that community outreach? Can they contact the hospital or you?
Well, the hospital is actually, as we speak, working on the grant money, and so they're asking people that are interested in the program to be patient. We're hoping to get it funding so that we can put it into all of the schools, hopefully in the Monterey area, at no charge to the schools. And that's kind of a process that's happening right now. So I don't have a firm answer. They could always, though, call our office or over at Ryan Ranch, which is, I don't know if you want the phone number.
Sure, that'd be great.
Phone number.
Give out the phone number.
Okay, it's Community Hospital's Diabetes and Nutrition Therapy Program, and our main number is 649 7220.
7220. So that would get a caller, 649-7220, that will get a caller right to the office, and they can inquire about community outreach programs or how to get some more advice about eating properly.
Right, or if a parent was concerned about a child that had any kind of a medical issue or wanted to be seen by a dietitian individually, that would be the same number to call.
Perfect. Now Barbara, a related question. Would you speak to an adult, say a 50-year-old person who felt they needed to lose 30 pounds, or their doctor said you'd be better off if you lost 30 pounds? Do you talk to a person or approach the issues differently if they're 50 as opposed to if they're 12 years old?
Yes, we do, because a child has the growth on their side, and I can use a growth curve with a child and show them as, you know, they're making changes, they're growing into their weight, and maybe we would not expect such a dramatic weight loss with a child when they're still growing. So we want to protect their growth and their development while they're losing weight. But I usually tell the children, I said, you're really fortunate to be here at this time, because you're learning things that maybe your friends won't be learning until it's too late, until they already have the bad habits. So that's really the purpose of the Kids Eat Right program, is to catch these children young, and if they're not already obese, to help prevent that from happening.
Well, excellent. And Barbara, you know, a related issue that we see in the news a lot are young people, especially young women, who may look at role models, fashion models, et cetera, who are underweight. Yeah. And sometimes they can develop eating disorders and not eat enough. On one end of the spectrum, there's the obese child, and perhaps on the other end of the spectrum, there's a child that is almost afraid to eat, doesn't eat enough. Mm-hmm. Are you able to counsel, and is there a community outreach program for those children as well, or those young adults?
We have a couple of the dietitians that work in my office that are specialists in eating disorders. And so those patients really do get individualized care, but we know that certain types of eating disorders really is a psychological issue, so we teach the nutrition, and we almost require that they also get counseling and work with a therapist going through that process.
Excellent. I know those are difficult problems, and I think if there are parents listening or young people listening, I think it's you offer a great resource, and we're going to give out the phone number again before we go.
Good.
Well, let's change. Boy, the time is flying. I hope you come by again on the program again, Barbara. Mm-hmm. Let's touch on diabetes education for the young person and for adults. What role does nutrition and diet have for a person diagnosed with diabetes?
Well, we're starting to see more children with the type 2 diabetes that we used to call adult onset. But now, because the children we're becoming bigger and more obesity, we're seeing more children having type 2 diabetes at a very, very young age. So the diet and the exercise are very important for that insulin resistance that is usually associated with type 2 diabetes. Okay,
Barbara, now I just want to clarify for our audience. We can say that there's insulin-dependent diabetes,
correct,
right, mm-hmm. where someone gets insulin injections or takes insulin to bring down their glucose in their bloodstream. And then there's insulin or non-insulin dependent, right, where they may be resistant. Mm-hmm. And oftentimes that type 2, that patient or person may be overweight. Is that correct?
That's correct. And insulin, the type 1 diabetes, which again used to be called childhood onset, people with type 1 have to take insulin or else they die. Some people with type 2 still need to take insulin, but they still have type 2 because their body is still producing some insulin. But they are different conditions, but the treatment for them is very, very similar as far as diet and exercise and the meal plans that we would help them with.
Okay, so the point being is that you're seeing more and more young people who are so heavy that at a young age they develop the type 2 diabetes.
Right. We see, as you see the obesity issue going up, you see type 2 diabetes going up. The two are very, very closely related.
Well, Barbara, teach me and teach the audience. So for someone diagnosed with type 2 diabetes, or they do not necessarily have to take insulin, mm-hmm. do you recommend to them low-calorie diet, low-carbohydrate diet, avoid candy and sweets and sugars? Like, how's that work? How do you start?
The nice thing is that we can individualize the diet. We cut out the extra source of calories, so it is a low calorie. Some people need more protein, other people need more fat, depending on what their medical condition is. But generally it's carbohydrate controlled. So they're eating, they're eating a consistent amount of carbohydrates in their meals and snacks so that their body can handle that load of sugar and starch in a healthier way.
Well, Barbara, a lot of the parents might ask, is it so bad that my kid wants to have a sugary cereal in the morning? you know, frosted this and sugar-coated this, and they might say that I can't get my kid to eat breakfast if they don't have all those sweet tasting grains or all those carbohydrates. So what do we say to her? Is it that bad, or
Well,
is
we've
it
never
good?
seen a child starve to death because their parent did not give them a sugar-coated cereal. You know, if children are hungry, if they're presented food, healthy food, we call it a light but not depriving food environment. I mean, kids go to birthday parties, they have pizza. So it's not completely making them eat carrot sticks all the time, but it's a mostly healthful diet, and that the family is eating together and the child is learning how to prepare some of these foods at home. Very
Excellent.
important.
So in the Kids Eat Right program, I want to know a little bit more about this. So you can actually help the kids learn how to prepare some foods and prepare meals.
We do. We have a short little nutrition lesson. For instance, last week we were talking about the sugar sweetened things. We actually had different kinds of beverages, and we had some sugar cubes, and we had the kids guess how much sugar was in each of the beverages. Then we do an exercise session, and then we actually have a food preparation session each week when they come in. So they learn a recipe using healthful food.
Excellent. Barbara, you know, unfortunately, we only have about 2 more minutes, so I do have a couple more questions for you, and then, of course, we're going to give out the phone number again. But I have another question for you. What about the whole soda, sugar sodas in schools for kids, and is it okay when you can go to a certain store and get a soda that's a foot high? I mean, is that so bad, or is it really not good for a person, a young adult, or an adult to be having that much soda? Do you have a take on that? Do you have an opinion?
They have found an association between the increase in the sugar-sweetened beverages and obesity. I don't personally believe that in itself is the cause of our obesity, but it certainly does contribute to that. And a lot of children who can just stop drinking sugar-sweetened beverages, which is one of the goals, by the way, in Kids Eat Right, can see dramatic results, because that's a form of pure sugar, just calories, nothing that's going to help the child grow and develop. So they're calories that the child really doesn't need.
Well, that's fascinating. And so you encourage some of the specifics in the Kids Eat Right program. Is it more vegetables, more salad, low-fat meats, etc.? We
bring an unsweetened beverage every week for them to try. And then we talk about whole grains, we talk about fruits and vegetables. The children identify fiber on a food label, so maybe when they're with their family, they can buy something that has some dietary fiber in it. So we touch on a variety of things, but at the kid-based level. These children are usually 4th and 5th graders.
Excellent. Well, Barbara, I want to give out the phone number again. Once again, Barbara Quinn, RDN, right?
Correct.
Registered dietitian and nutritionist, correct? If someone wants more information or wants to inquire about the Kids Eat Right, or perhaps they want some more information about nutrition and diet, 649-7220, right in Monterey, 831-649-7220. Our expert in diet and nutrition, therapy, etc., Barbara Quinn. Barbara, thanks for coming on the program. I hope you come on again. I feel like time flew by.
Oh, I'd love to. This has been fun. Thanks for having me.
Thanks for being here. Once again, I'm Dr. David Morwood. I am a board-certified plastic surgeon, and this is Your Health television program. We're going to take a very brief pause for a very good cause.